Thanks for staying with us. It's that time of year again when medical aid funds are running low and some are already depleted.
The coronavirus pandemic also having taken its toll, with many losing their income. And when children get sick and they need urgent care, life can become incredibly stressful when you don't have money coming in and lots of money going out to medical aids.
Indeed, it's an age-old problem, isn't it? Let's discuss what to consider when deciding on medical aid scheme cover with the Board of Healthcare Funders Managing Director, Dr. Katlego Mothudi, who joins us live via Skype from Pretoria. Dr. Mothudi, thank you so much for joining us this morning. It's been, before we get into the details of how people can start making the right decisions, it's been a tough time for many involved in the health sector, depending on where you are in that ecosystem. Medical aids have had a very, very busy time of it as the world and indeed the country battles COVID-19. Just generally in your position with the Board of Healthcare Funders, how has South Africa's medical aid industry dealt with the challenge of COVID-19?
Morning, Marcel and Dial. Thank you very much for having us. It is indeed a tough time, and this year saw us dealing with a pandemic that we were very poorly prepared for. I think from the medical scheme side, there were always a worry around what sort of impact on the claims we are going to have. But what we eventually saw was a bit different. The first thing is that we started seeing people accessing less healthcare because they were running away from the streets and did not want to contract the virus. Now, it had a ripple effect on almost all the parts of the supply chain, whether you have doctors shutting down their doors, hospitals having to change the way they are running things. We had to introduce new measures to safeguard the population and the workers, bring in PPE, pre-admission testing, etc. So it did indeed turn the world upside down, including that of healthcare.
Dr. Mothudi, I think one of the biggest talking points as far as medical aid during COVID-19, and whether we're talking about medical aid or a hospital plan, it's some kind of third-party medical care that people are paying for during COVID-19. In the end, medical aid schemes are a business. They're there to make money. Yes, they provide a service. But many South Africans, most South Africans, I think, would have taken a hit financially during COVID-19. And a lot of medical aids took a lot of flack for not adjusting their pricing to try and support consumers. Yes, there were some who did a lot of work, but there were others who simply didn't. Was there kind of a general plan around medical aid schemes and funders as to what to do during COVID-19?
I think there were a number of interventions. I think all the schemes and the environment were aware that there would be a financial impact. And I think the first one that was popularized by the banks was the issue of a payment holiday. Now, medical schemes, even prior to the Council for Medical Aid issuing a directive, had actually approached the scheme to allow them to be able to make that decision individually. Some of the schemes were fortunate in that they had a direct relationship with their employers, and they could at that level decide to maybe increase the amount that the employer pays towards the contribution for their members. Some decided that they would give a payment holidays, and then others allowed members to downgrade the level of their payment even during the year. You would be aware that according to the Act and some of the schemes that you can only change your options once a year. And those are just some of the interventions that they put into place. And then a few other interventions like relaxation on network rules. You would be aware if you're part of a network and you go beyond the service of a network, you might be faced with a penalty. I know a lot of other schemes started waiving those penalties, allowing people to find care where they could.
Now, human nature is a funny thing, Dr. Mothudi. You find people, when they are victims of crime, all of a sudden you're paying attention to what the finer detail of your insurance is. And one would think, as a result of this health crisis that we still find ourselves in, that you'll have more and more South Africans looking at what are the finer details of their medical aid schemes. And I would think many more younger people realizing, wait a minute, I can't just expect nothing to go wrong just because I'm young and fit and healthy, because everybody was equal in front of this COVID-19 monster that we all had to face. Are you expecting an uptick in especially perhaps under insured South Africans who are now looking at what their options are in terms of medical cover?
I think definitely people worry in terms of the type of care that they would get. And I think more so if you've been hit. So those people who do have the means, I expect that they would look for medical cover. But also importantly, I think it's important that people must understand how medical schemes work. We've had queries, for example, people who are on medical aid, but they are only registered on a hospital plan, and they had no idea how to approach the COVID situation, not understanding that COVID being declared a prescribed minimum benefit, even if you're at a hospital plan, there are certain out-of-hospital benefits that you can actually start getting as part of this. So there is a general need for people to understand the plans, and I think that if you look back at the Health Market Inquiries report, they did say that our world is complex, and it looks like the industry is not doing a lot to try and educate people on how medical aids work. So I think the issue of knowing how to go about it, finding the right sort of help to choose not just your medical aid, but also the plan that you are going to be on is very, very important.
Just very quickly, because we have run out of time, just before I let you go, getting to the front of the pharmacy and you're wanting your medical aid to pay for whatever you have, this time of year you often get the response, "Ooh, it seems your savings has run out." And unfortunately, it's a problem every year. What should people be doing if they do find themselves at a certain time of year where they seem to have run out of funds with their medical aid? What should they be doing so they don't go through the same process the following year? Just very quickly before we let you go.
Yeah, so I think we have to start at the beginning and say, when you choose, you must assess your health needs and also the needs of your family before you look at affordability. Often you look at the affordability angle, and then we are often drawn about the additional elements around the scheme before we look at our health needs. How young is your family? Are you going to need dental care? Have you got people with mental health issues in the family? Have you got people on wheelchairs, etc.? And then you engage with a broker and ask them to take you through those things with the information that you'd have had. It will minimize the eventuality of you running out of essential benefits.
Okay, thank you so much. That is Dr. Katlego Mothudi joining us live via Skype from Pretoria. He is the MD of the Board of Healthcare Funders. Some good advice.